Joining us now is Assistant Health Secretary, Dr. and Admiral Rachel Levine. Admiral Levine, thank you very much for being with us. First of all, when can we expect more vaccines to be made available? And you just saw what Antonio is reporting about the website is crashing. It is reminiscent of the rollout of the COVID vaccine.
Well, we will be expecting more shipments of the vaccine, the Jynneos vaccine from the company, and we have ordered more for future distribution throughout 2022 and to 23. Certainly, we need to coordinate with local, state, and federal public health to be able to address this significant public health threat.
How significant is the threat? Now, we understand that monkeypox is not transmitted the way COVID is, through the aerosol transmission. It is usually through sexual partners, through fluid exchanges, but that still means that it is, it is very contagious, correct? And it is a real threat. Is this a pandemic?
So this is not a pandemic, and this is not COVID-19. As you've been saying, this is not transmitted through the air like COVID-19, but it is a significant public health issue that we're taking very, very seriously.
Is it limited to men who have sex with men, transgender or non-binary individuals? Give us a sense of the population. Or how widely spread it is in the general population.
Well, it's important to remember that anyone can contract monkeypox, but right now the community most affected is the LGBTQI plus community, particularly, as you said, men who have sex with men. So gay and bisexual men have been most impacted, but it does have the potential to spread, which is why we're working in the federal government with state and local health departments for containment. We've significantly increased testing and to want them to be working on contact tracing with isolation and quarantine. And then we are distributing all the vaccine that we have and purchase more, and we'll continue to distribute that. And there are effective treatments. Now, the vaccine and treatments were originally designed for smallpox, but they are effective against monkeypox.
We've got a press release here from Sonic Healthcare USA, which is quoting Rochelle Walensky, Dr. Walensky at CDC, saying that there is an agreement with this company for better testing, so that you would have better data. I assume that that is an official announcement.
So we are increasing the amount of testing throughout the country through LabCorp and many other commercial testing companies to make sure that we get more information and more data about the extent of the spread of monkeypox, which gives us much more information in order to address it.
Also want to ask you about COVID because the most immune-evasive subvariant is driving cases up. Hospitalizations are also rising. We know that a booster is going to be available in September. But how concerned are you about the summer surge? And will that booster be after the surge? Will it be really too late?
So we are certainly still concerned with COVID-19. The pandemic is not done yet, and we're concerned, as you said, with the rise of particularly the BA.5 variant, which seems to be the most contagious variant yet. But we know what works. We have the tools in the toolbox in order to address this, and that includes our safe and effective vaccines and boosters, as well as testing, which is available throughout the country, and then wearing masks according to the CDC guidelines, depending upon the amount of community spread in the area in which you live.
I want to ask you also about transgender Americans, because you're the first openly transgender official confirmed by the United States Senate. In a recent op-ed, you urge people to base medical decisions and public statements on real data and compassion rather than slander. And you spoke to trans youth in Florida recently. Tell us what you told them.
Well, trans youth are vulnerable, and they suffer significant harassment and bullying, sometimes at schools or in their community. They have more mental health issues, but there's nothing inherent with being transgender or gender diverse which would predispose youth to depression or anxiety. It is that harassment and bullying. Now they're suffering politically motivated attacks through state actions against these vulnerable transgender youth. This is not based upon data. These actions are politically motivated, and so we really want to base our treatment and to affirm and to support and empower these youth, not to limit their participation in activities in sports and even even limit their ability to get gender affirmation treatment in their state.
No, you chose Florida, of course, the home of the Don't Say Gay bill, of course, which has been notably restrictive.
So that is correct. You know, the studies show from the Trevor Project that all it takes is one supportive adult to make all the difference for an LGBTQI plus youth, transgender youth, in terms of their risk of depression and suicide. One supportive adult. That often is a teacher or a school personnel, and the Don't Say Gay bill is very damaging to their health.